Shockwave therapy for lateral epicondylitis, a study on shockwave treatments versus a small physical therapy or conservative therapy trial. Now, this study was published, and what it did is it looked at how did people do when we treated them, and then we came back in 6 and 12 months and measured again how they do. So at 3, 6, 12 months, and then we compared the results. And what it showed was the shockwave group did better than the conservative treatment group. And the scores were definitely significant at the 6 and 12 month mark, and people were quite a bit happier getting shockwave treatment on that muscle tendon that had been painful in their elbow compared to a very, I call it, watered down physical therapy approach. Just putting a little ultrasound and ice, I wouldn't call great treatment for tennis elbow anyway, but that's what the study did. And the question gets to be sometimes, why is tennis elbow so tough to resolve? Why does it not want to get better? And why do people end up having for months on and off? And the recurrence rate's pretty high. And partly is anytime you get a chronic repetitive stress injury, they like to linger. And especially when that tissue tends to get a lot of scar tissue or fascial adhesions, whichever term you want to use, into that tendon towards bone attachment site. And the next time you go to use that area again or start to increase your activity, you overwhelm it and flare up the weak spot. And this happens over and over again in places around the elbow, shoulder, low back, knee, and foot. And this happens a lot when we increase and decrease our stresses or decrease our activity, or hey, I'm going to start working out at the gym, start pulling a bunch of weeds in the backyard, doing things I'm not usually doing. And especially with the forearms, you got to think about your total workload. The home, work, and recreation all add up in units to say how much force is that tendon taking on a daily basis. And to get better in any of the chronic repetitive stress injuries, you have to do more good than bad. So I think of like good and bad on teeter-totter. If bad's doing a little bit more, you're going to tip that teeter-totter toward the bad end and risk a flare-up, where if you're doing more good, you're going to tip it in the right direction. And that's what we work with in some of these injuries. The bad part with tennis elbow, especially, is those fascial adhesions that build up on that muscle tendon junction or that tendon to bone junction as it wraps back around the edge of the elbow. When those little weak spots then get the next stress load, they're going to flare up and we have this injury again. And successful treatment involves definitely knocking down the pain. You got to stop the pain. Nobody's happy with their elbow hurting. But you also have to stop the tissue damage that's occurring going forward, that teeter-totter. You have to stop doing too much bad and do more good to it. And we'd find ways to increase tissue repair. And that's where Shockwave and Graston really help the most with any of the chronic repetitive stress injuries, is how they're able to break down that scar tissue and trigger the healing process within the tissue. And without that, you just risk next time the tissue gets overwhelmed, flaring back up again. And then with tennis elbow, we're working on upper extremity mechanics, whether that's upper back and shoulder involved or just the elbow, wrist, and hand. Where's your weak spot into that? We have to get the arm able to handle the next set of stresses you're going to place upon it, because the next time you do too much, we don't want to flare up. And any of these injuries, to me, is you got to bring a bunch of different tools to the treatment plan. Just one isn't going to help. So yeah, Shockwave by itself showed progress, but it didn't solve the problem completely. People weren't 100% happy. They weren't 100% resolved. Doing a little ice electric ultrasound isn't great therapy either. From a conservative therapy standpoint, that's kind of half-assing it. You're not doing a great job. We have to find ways to mix in the soft tissue treatments, whether that's Graston, Shockwave, ART, massage, dry needling, or better yet, a combination of several to get that tissue to break down and heal and repair again. And that's what Shockwave was doing in this example, is mechanically pounding on the tissue, breaking down those scar tissue bonds and fibers, triggering a healing response that then came in and put down good tissue and replaced the bad. And that bad scar tissue tends to occur when we get a system process where we're just trying to throw down a quick patch to hold down the fort for what we got, and we'll come back and fix it later. But it doesn't. And the next time you overwhelm that spot, you get more of a cheap patch and more of a cheap patch. By overwhelming the system, that mechanical pounding, we're triggering that healing response to go in the right direction to put down good solid collagen fibers. And Shockwave and Graston both work through the same mechanism. Graston shearing across the tissue to tear it up versus Shockwave that's stomping on it. I think laser does a fantastic job of shutting down some of the pain and inflammatory pathways to help feel better quicker. Using that with the ice electric ultrasound is a good adjunct for it. deep tissue laser is also going to help with those fibroblasts, those repair cells, to get them going faster, to get better healing. And then you have to do the stretching. You have to do some of the exercises, finding ways to put a greater stimulus into it to trigger proper healing, but not overwhelming the tissue so that you break it down faster. It's a balance with the exercises, and using braces and other home products to help with the healing and that teeter-totter, doing more good than bad. So in this study, the conclusion was Shockwave was better at 6 and 12 months compared to ice and ultrasound, which I definitely would think so, but still wasn't fantastic. What does the study really kind of tell us? No one treatment's going to be perfect. We got to find ways to combine treatments and bring as many as we can to effectively get the results we need. Now, I think in this study, it'd be more interesting if we had combined not just a third group of the ice, ultrasound, and shockwave, but what if we combine some of the better treatments we've known for a long time that are out there? I think the results would have been significantly better at the 6 and the 12-month mark. So getting in the physical therapy, the laser, the stretching, the exercises with the soft tissue treatments of Graston and Shockwave would probably have gotten quicker results, but also a heck of a lot better and happier patients at the 6-month and 12-month mark. So you can read more on tennis elbow and the treatments available on our website, or going and downloading our elbow pain treatment guide. That'll give you not just the treatments we're talking about here, but other things you can do at home to help speed up your healing and recovery. Thanks for listening, and we hope you have a great day.